Earlier this year, a Christian man fled persecution in Pakistan and came to Saskatoon. And then he learned he had cancer. So he came here for treatment. But the federal government told the cancer agency it would not be paying for his chemotherapy. The man doesn't want to be identified. He's a refugee claimant seeking asylum. But Sister Carol Borison is speaking for him.
This gentleman's life was on the line, and the amount of anxiety and stress that had been added to his situation was awful.
Back on July 1st, the federal government introduced sweeping changes to health care for refugees. It's a move that has sparked widespread protest. So-called supplemental benefits like glasses, dental care, and prescription drugs were all cut, and that includes chemotherapy.
This should not be happening to people who come to our country hoping to make a new life.
I don't understand the decision.
Saskatchewan's Premier says it is unbelievable that the federal government is refusing to pay for basic care for a refugee claimant.
I think it's very much a part of Canadian values and a part of Saskatchewan values to want to make sure that these people who are obviously very vulnerable, especially then if they have a medical issue that they develop either before or after they arrive, that we help them.
This refugee was diagnosed with cancer.
This case was raised in the House of Commons. The government says there are limited benefits for people claiming refugee status, but not yet actual refugees.
They receive comprehensive health insurance, but not extended benefits.
Now, as for the man at the center of this case, he's not talking publicly right now because he's still applying for official refugee status, and he doesn't want to ruin his chances. He hopes to one day bring his wife and children to Canada as well. Geoff, CBC News, Regina. What are your thoughts about the fact that the federal government has refused to pay for cancer treatment in this case?
Well, in terms of what we can control, we're going to pay. We're going to cover these costs, and if there's urgent medication, we want to cover that too. Yeah. We'll worry about who pays later. That's what the Minister of Health said yesterday. Yeah. That is the position of the government. I think I don't understand the decision. These are refugees. They are fleeing persecution. They're fleeing any number of things that happen to them or happening to their countrymen from where they've come. And this is Canada. And I think it's very much a part of Canadian values and a part of Saskatchewan values to want to make sure that these people who are obviously very vulnerable, especially then if they have a medical issue that they develop either before or after they arrive, that we help them. And that's the position of the government, and I frankly don't understand the position federally on this.
And I think the minister is saying we can't afford it. We can't afford this sort of cancer care.
I think we can. In our government, we work hard to balance the budget, and we make difficult decisions to fund certain things and not fund certain things. But the reason we want to balance the budget is that's what underpins what we call the Saskatchewan advantage, the economic growth that we welcome. Yeah. And we don't seek growth for its own sake. We seek it so that the dividends of growth can do what? Can help people. We can invest in health care and education. We can build roads. Yeah. That's the purpose behind it. And in this country and in this province, we are, compared to other places in the world, rich beyond measure. So I think we can afford it. We can find the dollars.